All right, thank you. So we only have one guest speaker. Unfortunately, Christina is ill today, so she will not be joining us. So the topic is the women's health landscape in Texas, from uninsured and bridging gaps in care in rural South Texas communities. I'd like to introduce the CEO of Women and Men's Health Services of the Coastal Bend, formerly Planned Parenthood, which I was on the board for, I think, 7 or 8 or 9 years, something. I lost track after a while. I'd like to invite Mandy Stukenberg to come up and talk to us about women's landscape of healthcare in this country at a time. Give her a nice round of applause. All yours.
Thank you. Thank you all. I'm sorry my voice is kind of froggy, and I'm sorry Christy couldn't be here. I wanted you all to get to know her. I feel she is the future, which I'm looking forward to. I'm really honored, thank you, to invite me to come today. I know this congregation is full of the most thoughtful, informed citizens that you can find in our community, and your motto of integrity and service has impacted so many agencies. Mine alone, I've had wonderful board members for years, Django, Robin Kennedy, Jessica Latimer, so many people, so many supporters. But it's not just our agency. When I look around town, there's so many others that have benefited from the service that the members of this congregation provide. So I am with Women's and Men's Health Services. As Django said, we started as a Planned Parenthood organization in 1958, and it really started because there were so many women being admitted to Memorial Hospital following botched abortions. And there were some Unitarian ministers that got together and said, we can do better than this. And I think that has been our philosophy throughout our history. And so they founded an organization that provided preventive health care, birth control, helping women understand and plan their pregnancies, and they were very successful. They set up clinics across Nueces County, and they actually went to Washington and were one of the first agency in the country to be funded by the Office of Economic Opportunity as a way of reducing poverty, and the concept that providing health care to women to help them plan and space their children is a poverty reduction measure was a new belief. But what has, I think, made us particularly successful is that unlike so many organizations, both for-profit and nonprofit, is that organizations tend to centralize power, money, structure. They want to standardize everything because they believe that way they can provide better service. And I think, as Django has found in his search for healthcare, when you lose local control, when you don't have people you know who are running the boards of entities, decisions are made that don't always result in the best services for your local community. And I think one of the reasons we left Planned Parenthood and became an independent nonprofit was because we did not want to be standardized. And so our philosophy has always been, we need to fill the gaps in services in medical care in our community, particularly for people who have no insurance, they have no money, and they have desperate health needs. So we, for a long time, focused on teen pregnancy prevention at Planned Parenthood because it was such a huge need in this community. There was nowhere teens could go to even learn about their bodies, about pregnancy prevention. And we got some wonderful federal funding called Title X that allowed us to provide services to minors without parental consent. And that has been true up until last year or the year before, when a judge, federal judge out of Amarillo, that they judge shopped, Deborah can, I don't know what it's called, but where you find the judge is going to do what you want him to do, ruled that that violated a father's right to control his daughters. So now, in Texas, minors need to have parental consent in order to get birth control. There is an exception. The state always has said that minors can access STD testing because they realize the value of not spreading communicable diseases, and they can get pregnancy testing to find out if they are pregnant. So we focused on that for many, many years. For a long time in this community, we were uniquely plagued by fights over abortion services. And many of you will remember when abortion became legal, we had two providers here in Corpus, Dr. Aquino and Reproductive Services. There were protests, there were arrests, they blocked the clinics. The sheriff refused to arrest the people that were blocking access. We were all over newspapers across the country. This was a focus of the abortion battle when it first rolled out. And eventually they fire-torched Reproductive Services and burned it to the ground. They excommunicated the head of Reproductive Services, and they excommunicated Dr. Aquino. And as two very faithful, devout Catholics, that was a very painful experience. But abortion remained accessible and viable in Texas, but then they began enacting rules around you had to be a certain kind of clinic in order to provide those kinds of services. You had to have all kinds of, the facility had to be far more than anyone could afford. And then they instituted, you had to have hospital privileges, and they leaned on the hospitals not to give doctors hospital privileges. So essentially they managed to make it almost impossible for women to find care. And as of today, that's even more true than it's ever been in Texas. Technically, abortion is illegal in Texas. We are allowed to give people information about abortion, but we can tell them where they might seek care, but we cannot assist them. But where they have to seek care will be out of state, either New Mexico, they have to get out of Texas, and for many women, that is just simply not an affordable alternative. And if you go to the trade center regularly, you might find out there from people you know there, where you might find pills or medication abortions. You could go to Mexico if you want to venture across the border and seek health care. But other than that, your best hope is to see if you could have it mailed, medication abortion through the mail to your house. But it is illegal. They say they're not going to punish the woman who seeks the care, but they will punish the doctors who try to prescribe it for you. And one of the problems is that it's very unreasonably cruel to expect women to go through that kind of a procedure alone at home without any medical care or anyone knowing, in many cases, what she is going through. So that has been an ongoing challenge for us of what to tell people, of where to seek care. So we have focused on what we have always tried to do, which is help people avoid these situations. And if we can provide them with information about birth control, accessing care, how to, take care of themselves, avoid domestic relationships that are very abusive, if we can help women improve their health before they can have much better birth outcomes and much better health for women in general. One aside comment on abortion, and then I'll move away from it, because we do not provide abortions. We never did. But it seems to be, if you provide women's health care, abortion is part of women's health care. And we have learned that the hard way with so many women who have gotten pregnant, who have early miscarriages, who have pregnancies that are not viable, who go to the ER because they need to get a D&C, they need some kind of health care, and the ERs don't want to touch them. They will say, oh, go home and come back in a couple of days. And we all know people personally who this has happened to because the doctors are scared of getting in trouble of doing a D&C on a woman who might be hemorrhaging badly because he does not want to be accused of doing an abortion. And they have these committees in the ERs that decide whether this is a justifiable procedure or not. But they're not always there on the weekend. They take days to operate. So what happens is doctors make a conservative decision of, I'm going to push that away from me. My shift is 2 hours. Somebody else can deal with that when she comes back. And women go on to have ectopic pregnancies. They lose their ovaries. Their life is in jeopardy. There are horrible outcomes for women who were truly seeking to have babies, that wanted to be pregnant. They were simply seeking health care. And because of the laws they have passed over abortion, they have scared doctors out of using their best judgment. And that is a real, real tragedy. We mentioned the most effective methods of birth control that women can have that last 3 years, 5 years, 10 years. We provide all our services at no charge to patients. We currently have 4 clinics. There's 2 here in Nueces County, 1 down Holly Road near Caroline and Holly, 1 over on Ayers near Galahar, right opposite the Medicaid office. We have 1 in Kingsville and 1 in Alice. And what we have found in looking at local needs is there is just very little health care of any kind in the valley. It isn't just reproductive health care, but you have to travel long distances to find a doctor. If you live in rural Jim Wells, Jim Hogg, if you get down far enough away from Kingsville and Alice until you hit McAllen, where the work of Senator Hinojosa in investing in new hospitals down there has really provided a lot of health care. But we are focusing on now a new project we have with Mobile Health Van. We currently serve about 17,000 unduplicated patients a year. About 85% are women, 15% are men. And we have expanded not just our geographic territory, but the scope of care that we provide. Because a lot of the problems that women encounter during pregnancy are because they came into pregnancy in such poor health. They might be diabetic and they're not taking any medications. They might be hypertensive. So the state finally recognized if we could help women get healthier before they become pregnant, you will have much better birth outcomes. So we do a tremendous amount of medical care for diabetes and for hypertension, which is not what you would think a women's health clinic would be in the business of doing. But it's forced us to have to change who we staff with. We have a staff of about 45 people. We have 9 nurse practitioners. We have 2 medical directors, but we need to have more physicians available to us on site, because when you're providing more primary care, we see people who come to the mobile clinic with every possible problem you can imagine. But the huge challenge for us is as you go through these little towns, and I have a map here, Michael, could you hand out? This is my husband, Michael, my assistant. That shows, where we have been providing services through our mobile health van, but it's to the small towns like Rialitos and down to Fallon, Concepcion, Hebronville, Freer, And we're going to be expanding into some further counties that have no services. Frio, Dimmitt, Maverick. These are very rural counties. Some of them are border counties, and you encounter a lot of the issues that you get on the border. But these are the most underserved areas in the state. So it's a very small van, but it's very easy to drive. We don't have to have a fancy driver or a special license. And the staff is very, very excited because it's incredibly rewarding to go into one of these small towns and see the kind of reaction from people when you say, we'll be coming back once a month or once every 6 weeks. We also have found that we have raised private funds where we can give people gas cards to drive into some of our brick and mortar clinics. The challenge also for us is to try to find partners in all these small areas to coordinate with. So if we have someone far beyond our scope of care, we can refer them to someone that's somewhat closer than Alice, Kingsville, or Corpus Christi. So the state of healthcare in Texas is pretty awful. It's awful both for people who have insurance, but it's particularly hard on those who don't. And for reasons beyond our knowledge, the state has always refused to expand Medicaid coverage, which is how most states cover underinsured poor people. Texas will not do that. And then they do things like they no longer will report data on maternal mortality and morbidity to the CDC to be part of the national surveys that can recognize what are the needs and what is happening in each state. So not only have they minimized access to services, but they have tried to relieve themselves of the responsibility of gathering the data that can accurately tell what is the real needs in the community and what is really happening. So we have been fortunate. I mean, we have really managed to thrive. As I say, we have a budget of almost $8.5 million. We have 17,000 unduplicated clients. We provide both your visit, your medication, because we have on-site pharmacies, even on the vehicle. We have on-site labs, so you have your lab done when you come. The concept is treat everybody for everything you possibly can at the time they're right in front of you, because you don't know when they're going to be able to get back to see you. You don't know if this might be the only time you see them all year. So you need to hand out a year's worth of birth control, or at least 6 months of the primary care medication, so they have a time to really use it and see if it's really working. You cannot demand, why don't you come back in 3 weeks and we'll see how your lab work is. That's not going to happen. So you have to operate in a way that's medically a little different than you do when you're in your your little office where you tell somebody, well, you better be coming back. Although, as Django finds, they won't even see you for six weeks because they can't get you in. And in many ways, I feel our services are more accessible than if you had private insurance because, A, we answer the phone. How many doctors' offices answer the phone? We make a lot of appointments and we do a lot of things online because we found even in rural areas, people rely on online access to communicate, to find out what's going on. Facebook and TikTok, it's interesting, the teens are less a concern now than they used to be because they're so much more savvy than it used to be in the past. They can go online and find all the information that they didn't have before. They can order a lot of pills and drugs online, and I think a lot of them do. So that's the ones who have money. But even the ones who don't have money, once they hear, well, you can get this. But our prices are very, very affordable. We hand out probably 30 to 40,000 cycles of emergency contraception. Emergency contraception is a wonderful pill you can take that prevents you from ovulating. If you are already pregnant, it won't do anything to help you at all. But what it does is prevent you from ovulating. So if you have had unprotected sex and you take this pill, you will not be pregnant. That is a huge step forward for the poor teen who makes one mistake one night and then has to face being a parent when she's not prepared to be a parent. We also have new guidelines from the CDC that you can hand out doxycycline, which is pennies each, to people who have an unprotected sex who think they have been exposed to HIV. And it will prevent syphilis, gonorrhea, chlamydia, and can help reduce the transmission of HIV. So I think they've discovered there's a lot we can do proactively for people. The other area we need to get into much more aggressively, and you wouldn't think this is what Women's Health talks about, is the GLP-1 drugs, which are the weight loss drugs. Probably 60 to 70% of the people we see in our clinic are clinically obese. Obesity is a huge challenge. It's too hot. There's very little exercise. It's bad food. They can't afford good food. You can preach all you want about, going to the store and buying better vegetables and eating. But if we could help them access those drugs, they could lose weight. They would not become diabetic. A lot of them could get off their blood pressure medications. It has health benefits far beyond just the weight loss component. And why the drug companies have not made that available to everyone who has insurance, I don't understand, because it would save them tons and tons of money in the long run if people were not burdened by the complications that often come with obesity. But that is sort of where we are. I don't know, you all probably know a lot more than I do. In many ways, we've had wonderful support. But I'm open to any questions you all have. There's no age limit. We have different funding programs. Some are state, some are federal, some is Medicaid, and some is from private dollars. So we see people generally from age 12 to 70 or 75. And that's the other thing we're seeing with a huge need are so many menopausal women who are needing medication, needing help, and there's no funding available for women who at that age need some medical care. And the age of the patients we see generally used to be 18 to 24. That was who we saw. That is not true anymore. What we're seeing is like 24 or 25 to 40. And many of those women have already had their children. So they had a doctor when they were pregnant, and they had a doctor where they were having babies. But since they had that last baby, they haven't seen a doctor for 10, 15 years. When we go out in the mobile unit, they ask us to track how many women do you see who have not seen any healthcare provider for 10 years. And it's shocking how many there are. They've not had Pap smears, they've not had mammograms, they've not had any access to any healthcare. They do without. I mean, they have choices they have to make. They only have so much money or time. They can't afford to go get healthcare if it's not readily available. So that is the general focus of where we are going. I can't really answer how to fix what's wrong with Texas in its attitude towards healthcare in general, but I think what's happening in healthcare is nationwide. Unfortunately, we've infected other places with some of our bad ideas, but there's so many unintended consequences. Like, I don't think when they banned abortion, they had any idea what they were going to do to generalize women's health in Texas. OBs are not moving here. You cannot hire OBs. They do not want to practice in Texas. And it's what? Yeah. Well, maybe it was cruelty for people they didn't feel like were their people. But when it's their daughters and their, who are, wanting to have a baby and go to the ER and then lose an ovary because they had an ectopic pregnancy that no one would address until it ruptured, that's when kind of the light bulb goes off. But it's sad to think that we are probably in the worst state in the country for women's health.
Given that, what local volunteer opportunities do we have, particularly in the group?
Well, as we move into these smaller rural areas, it takes a while to gain trust. And you have to have someone in a small town that can tell people, hey, you want to do this. They're reliable, they provide good care. So I have a list of the places we've already visited. If you have any connections in some of the more rural areas, helping spread the word that the Women's and Men's Health Services van can really provide you with care that you need. They're not going to stick you with a bill. You're going to get your lab work and your pharmacy. If you come in, we see people with every possible kind of medical condition, and we may not be able to take care of all of it, but we can tell you what we think it is and get you started on something and refer you on. But that's our main challenge is in these small towns, you can drive out there, you can park your van, but until, and they'll be real curious about what you are, but you need an advocate in each of the little communities to say, these people are okay. You need to, give it a try. That's really our biggest need. Any other questions or comments? Yes.
Do you
Yes.
require a social security number or something like that?
Certain funding streams require it, others don't. I think the legislature would be surprised to know some of its programs cover undocumented. On the other hand, I think they're cynical enough, some of them, that they realize they don't want those people not having more children. So, yes, you don't have to have a social security card. And as I say, one of the things that's nice about being locally owned by our board is we have the capacity to make exceptions to any rule that's out there. I mean, we can just, if there's 10 people that come in that don't meet exactly the criteria, well, we can absorb that. And that way, people begin to trust what you're doing, they bring their friends, and you get much better compliance. But the whole issue of the who is a citizen really impacts, everyone who got on Medicaid during COVID got to stay on Medicaid through COVID. Once you got on, and most people get on when they're pregnant, most men never get on. There's no Medicaid for men unless you're disabled. But from a monetary standpoint, most women access Medicaid because they get pregnant and they have a child. And during COVID, from like 2019 till last year, last October, they were kept on Medicaid for 5 years. And that's when they ended the health emergency. And when they did that, everyone on Medicaid was booted off and they had to reapply. Well, Texas did not have even half the number of workers they needed to process applications. So thousands and thousands and thousands of women who should be on Medicaid have not been able to get back on because they're so slow in processing applications. But the other part that's happened is if you're in a household that because Medicaid now insists that they look at your entire household, and you have to list whoever lives there, whether or not, it's your husband or if you have an uncle or you have somebody living there that's a non-citizen, you're putting them in jeopardy when you apply for Medicaid or any other social service. So there's a big reluctance, and that's when I talk about trust, is there is a reluctance on a lot of people that they don't want to get on some government list where someone's going to come out and raid their household and look. But to me, the real need is not the undocumented, who tend to move through this area up to the larger cities. I mean, if you're in Houston or San Antonio, you're going to see more of that. Most of the people we see are citizens, and there are not jobs, or the jobs that are there don't pay to have insurance, and they're uninsured, and they just do without. And they use a lot of local healing, some of which is effective, but it's not the same if you have diabetes or hypertension or an STD. It doesn't work. Any other comments? Yes.
You mentioned that now 20. Sorry. You mentioned that you used to serve teens and young adults, but now you're mostly serving older women. So where are the teen and young adults going?
Well, we still serve them. They're welcome to come. But I think more teens access care through the internet. You can go on the internet and find a doctor to prescribe you almost anything. And teens are much more savvy about doing that. You have to have some money, and it's going to be mailed to them. I just think there's more parents who are aware they need to address their women's health concerns in their teens at a younger age. I think that's helped a lot. But I think that you can it used to be you couldn't even buy a pregnancy test at the grocery store. Now you can go buy your own pregnancy test and find out if you are pregnant. You can even go buy an STD test in a grocery store and see if that is an infection, if it's transmissible. We see a tremendous amount of STDs, but particularly concerning is the syphilis. The increase in syphilis is huge, and that didn't used to be true. And syphilis can have serious health complications for a fetus. So diagnosing what you have is really critically important. But it's a trend that is across all the family planning agencies in the state. They're seeing more slightly older populations. Maybe it's a good thing.
Comment on teens being able to get more information from the internet. There are people and forces that are trying to put a stop to that.
Yes, there are. And they certainly, very few of them are able to get much out of schools because schools are terrified of the new rules on, what can be taught about human sexuality or anything in schools. We actually have a lot of our staff in a lot of schools, but they're talking about vaping, bullying. Those are the areas that the schools will say we have needs. And so we come out and we'll talk about, we can do a lot of classes on that. And kids are smart. They figure out where you're from. They figure out what you can do. But you're right. Even on the internet, they're trying to limit access to information. But as someone who's tried to figure out how to monitor or look at what my grandchildren are seeing on their computers, I can't. So I'm confident that young people will be able to find what they want. They seem to be pretty good at it. They find some bad stuff, but lack of education that we used to see in teens, we rarely see. Now, do we see a lot of teens in unsavory situations where they have someone living in their household that obviously is taking advantage of them, but the mother doesn't want to do anything about it because he is bringing some money into the household? We see a lot of that. And we actually refer a lot to CPS, but none of it gets actioned. We get a notice back from CBS, we've investigated, there's no further action. So that's a very common situation. Gail?
I would be interested in knowing more about transportation services to New Mexico. I would imagine it's not publicly funded, but privately. Can citizens contribute to that?
Only if you want to go to jail, because that is what they have zeroed in assisting people with accessing services, and they are all over that. And they're even going after some mothers who drove their children. So that is where you have to be very careful. And you know, we get fewer and fewer calls. We can tell people how to call a clinic out of state. And maybe the out-of-state clinic is able to give them more specific information than we are. But we have to be aware with every call that comes in, it could be a plant, it could be a test, it could be someone wanting to see if we really are offering services beyond what is legal in Texas. And, but we do warn people that assisting someone to access that particular service is a crime here in Texas. Yeah.
Is that a crime to assist with going out of state?
Yes.
Can you repeat the question?
Is it a crime to assist with going out of state? Yes. Is it a crime to order medicines from out of state? Yes. He has tried, and can they make that actually work in court? They haven't had to very often, because you just have to have one or two cases that get a lot of publicity, and it has a chilling effect on everybody. You only have to catch one or two mothers driving their daughter to New Mexico for everybody to go, well, you know, better not do that.
Do you know for sure if they, is there a police officer at the border between Texas and New Mexico checking cars now?
No, but I suspect it has to do more with some right-to-life group in a community that's decided they're going to keep watch on. I mean, there is even, we are warned, we used to have apps that we would give people to track their periods. Because, you know, some people come in and they say, when was your last period? Well, I don't know. But, you know, so there was, and it would be a way to remember when to take pills. Now they tell people, do not do that online, because people can keep track of you and see when you stopped having a period. So, you know, depending on how active a right-to-life group there is, maybe it be local, but if it's online, it could be anywhere. So, no, there's not somebody at the border. It takes someone that has an agenda that's decided to make a case out of that, but you don't know if you're one of them.
All right, I think we need to terminate.
Thank you all.